Gambling addiction, also known in scientific terms as ludomania, affects about 15% of the population, mostly men. Usually, this disorder appears with other problems. For example, someone might be addicted to heroin or alcohol and also have a gambling addiction. Sometimes these addictions appear together as a complex set of symptoms. Causes of gambling addiction. Immaturity. Many patients are emotionally immature. They find it hard to take responsibility for their feelings and are afraid of making mistakes. Instead, they prefer to escape into another world, a fantasy world, where they don't have to deal with reality. Think of Las Vegas: bright lights, music, beautiful waitresses, free drinks. For adults and even teens, this escape can be intense and addictive. Escaping reality. These people are very sensitive and emotional. Everyday life may feel painful or overwhelming, so they escape into gambling where there is no time pressure, no responsibility, and they can feel alive. Seeking pleasure. Gambling provides a quick, easy dopamine or serotonin rush, a chemical in the brain that makes you feel good. Patients often struggle to relax in normal life, so they turn to alcohol, drugs, or gambling. Self-affirmation. Gambling can also give patients a sense of importance and control, helping them feel strong or smart, even if temporarily. What it feels like for a patient. Imagine being obsessed with gambling. Your mind narrows, your focus shrinks, and you become completely absorbed in the game. You plan every move, develop strategies, and believe you can predict the outcome based on signs or rituals. This obsession can take over your life completely, 24/7. When they briefly step back and realize what's happening, they see the devastation in their lives. Lost money, ruined relationships, lost jobs, health problems. This often leads to panic and desperation, which drives them back to gambling to try to win it all back. Common symptoms. Anger and rage when someone tries to take away a game or stop them. Withdrawal symptoms, similar to drug withdrawal, if they cannot gamble. Denial. I'm not addicted, I don't need help. Patients often hit rock bottom before recognizing their addiction, which is why early intervention is tricky but crucial. What relatives can do. Children. Completely remove access to games or gambling devices. Replace it with something equally rewarding but healthy. Adults. Seek therapy immediately. Also, join support groups for families of addicts. These exist for parents, spouses, or anyone affected by someone's addiction. Treatment for patients. Support groups for gamblers. Many cities have free groups of anonymous gamblers, where people share experiences and recovery strategies. Some have decades of sobriety and can mentor new members. Psychotherapy. Therapy helps the patient rebuild what they lost: their emotions, relationships, career, and self-esteem. The goal is to develop healthy coping strategies instead of escaping into gambling. Structured daily routine. Patients must follow a strict schedule: when to wake up, what to eat, what to do. They may need to change phone numbers or routes to avoid casinos. They plan exactly what to do when urges arise, such as calling their therapist or a support group member. Key rule. A strict daily routine is essential for recovery. Gambling addiction is serious, but with therapy, support, and a structured plan, recovery is possible. If you want, I can also make a version specifically for YouTube narration, with shorter sentences, natural pauses, and emphasis cues for easier reading aloud. Do you want me to do that next?